Hi, my name's Annabelle Collins. I'm a senior correspondent at the Health Service Journal, and I'm joined today by Karl Emms, who is lead nurse for patient safety and patient safety specialist at Birmingham Women's and Children's Foundation Trust. And Karl is joining me for the next in our series of honest conversations about safety ahead of our Patient Safety Congress, which is taking place in Manchester this September, and in which, Karl, you are a speaker at this year's Congress too. Thanks very much for joining me for this conversation. I think first I'd be really interested to know about your journey to become a patient safety specialist. When did you start doing the role and why did you want to do it in the first place?
I started at Birmingham Women's and Children's Hospital in this role just over 8 years ago now. And I've got to be honest, I hadn't considered a role in safety previous to that. It was actually a job I saw advertised, and it kind of it was interesting. Found out more about it, and it sounded like a fascinating role. And the job entails looking at our clinical procedures and looking at how we can improve the safety of that clinical procedure. Sometimes that's in response to learning from incidents. And it's very important that we're always open and transparent when incidents occur, and we're looking to how we can improve and make things better. But also, sometimes it's in response to proactive work that we want to do. If we've got a bit of an inkling that something might not be right, but we haven't had an incident, sometimes we'll want to go and have a look at it and do that proactive work and see if we can improve the safety of the system before harm has occurred to a patient.
Interesting. And I'd be interested in your thoughts on how you see the patient safety specialist role progressing in the future. I suppose, what are some of the perhaps major challenges facing that role, some of the key priorities for it?
For me, I think, first of all, I think the implementation of patient safety specialists in all NHS organisations in England is fantastic. It gives us a really consistent infrastructure across organisations to start building on the safety work that has been going on for years, of course. But it enables us to develop skilled specialists in each organisation who understand how to improve clinical safety, systems thinking, human factors understanding, and how to apply those things to safety work. For me, what I would love to see going forward is a real focus on proactive safety interventions. So, as I've said already, in my organisation, with the team that I work with, we have an ambition in our vision statements to not only be responsive to incidents, but also to start looking at proactive learning and identifying gaps in clinical procedures and processes before harm has occurred. And I think that could be a really interesting core element of a patient safety specialist's role. And could obviously be part of the national rollout around PISA, for example. I think that would be a really a good approach to have. I think the other aspect is developing that expertise around systems thinking and human factors and ergonomics. And obviously, with the national curriculum for patient safety being rolled out as it currently is, that's a fantastic first step. And I'm looking forward in the years to come to seeing that developing, so that we can really get to grips with how to use human factors, systems thinking, and all of that theory when we're approaching clinical safety work. And I think this is a huge opportunity that we've got.
I'd be interested to hear a bit more about PISA. If you mentioned that briefly just now, and that's obviously a big change for all trusts. I wonder how is that going at Birmingham Women's and Children's? It's I imagine it's a piece of work that you're really quite involved in.
Yes, and we're doing a lot of work on that at the moment, and we were not one of the early adopter sites. So there are other sites that are further ahead than us, and that's okay. So we're currently looking at our processes and procedures to make sure that we get that right, and we learn from some of those early experiences from the adopter sites on how we can implement that to best effect. But as an organisation and as a team, we're very excited about it because obviously there are things that we can do with PSERF that were not so easy with the previous approach to incident investigation, and that kind of intelligence-led investigation approaches and being able to adopt more proactive approaches to investigations and quality improvements work is something that we're very excited about.
Good to hear. And then I wonder if perhaps we could broaden the conversation out a little bit and talk about patient safety more generally in the NHS, as of course the NHS has been through a very difficult few years. I wonder, have you been at all concerned that some of the focus on patient safety has waned a little bit because of other pressures? And I wonder how you think organisations can keep that focus despite, as I said, being pulled in lots of different directions.
Yeah, we've had a number of difficult situations over the last few years. We've had a pandemic, which has had a huge impact on services, as we know, and of course the ongoing pressures that the NHS faces has only been compounded by the legacy of that pandemic as well. So we know we're in a difficult situation. That being said, that does create difficulties in terms of keeping a focus on patient safety, because obviously there can be distractions there when people are working under pressure. People working under pressure itself is an issue in terms of the safety of a service that's being delivered. Whilst also, you could be distracted from some of the quality improvement work and proactive work that you want to do if you've got, all hands on deck delivering clinical services and playing catch up on waiting lists, that kind of thing. The one thing I would say in our organisation that's really good is that we do still have a lot of quality improvement work going on, a lot of patient safety work and a lot of proactive work going on. So despite those pressures, there is still a clear commitment that we want to be improving things for our patients, getting things right, and also learning when incidents do happen. So despite the pressures, and they are real and they are there is still an ambition, there is still a huge appetite for safe clinical practice.
That's good to hear. And I suppose, as I said, you're speaking at this year's Patient Safety Congress. I wonder if you can give us a bit of a flavour about what you're planning to talk about.
Yes, Annabelle. So this year we're presenting a project that we have been undertaking over the last few years to improve the safety of IV drug practice, particularly around reducing the incidence and harm caused by extravasation. And we have not only used a human factors approach to help bedside nurses and doctors respond appropriately when extravasations occur, we have also implemented different design features, such as we have RAG rated. So we've come up with a risk rating for all IV drugs to help clinical decision making at the bedside as to whether a particular IV drug should go into a peripheral line, an IV cannula, for example, or one of the bigger lines that we sometimes use, central lines. And that has helped a lot of proactive prevention of serious extravasation injuries. And we've had some really promising results, which we're really looking forward to sharing with everybody. And hopefully, if other people are finding themselves in the same situation, then they're very welcome to adopt some of the stuff that we've done. We will very openly share our learning with them.
Well, that sounds like a really interesting project. I wonder, what was just briefly, but how long did it take to kind of implement that sort of change in the trust?
It has taken a number of years to get it right, and with any big project, especially when it's trust-wide and especially when it's complex, you're better taking a slower approach and getting it right than trying to rush, almost have a knee-jerk reaction, tick the boxes, because you'll only find later on it's not landed, it's not embedded, and it's not working and not delivering the change that you want. So it's taken about 3 years to get to this point. Some of that has been affected by the pandemic. So we didn't have to press pause on the work for a time when we were all redeployed, to cope with the pressures of a very unexpected situation. But also there was a piece of work around when we were risk rating all of the IV drugs. That's something that we couldn't find in the literature that had been done previously. So we had to undertake that work ourselves, and thankfully our pharmacy department, and one of the speakers that will be on stage with me, Rianne Isaac, who is one of our senior pharmacists, she undertook that work, and I was very grateful because that's her area of expertise. But that took several months to work through, because you're talking almost 300 IV drugs to look at very specifically and consider the risk level of each one of those individually. It was a big piece of work.
Yeah, I was going to say, it sounds like a huge piece of work involving the whole MDT.
Yes.
Well, it'll be good to hear more about that in September. And I think just my final question to you would just be, is there anything in particular you're looking forward to at the Congress this autumn?
I think the word is being inspired. Because I'm a regular attender at the Patient Safety Congress, and it's 2 days out of your working diary, which over a year doesn't sound very much, but actually you don't have spare days in your diary, so you are very particular about how you spend them if you are going to be away from your home organisation. And I put Patient Safety Congress in my diary each year because I always come away having learned something new, being inspired on a project, or having made contacts with people who are going to improve future work or future developments. It was the case last year, it was the case the year before, and I'm looking forward to that being the case this year.
Great. Well, on that note, I think that's a good point to wrap up our conversation today. But thanks very much for joining me, Karl, and I look forward to seeing you in September.
You're welcome, Annabelle. Thank you.